So obviously, most of your target population or the older age population with some kind of cognitive function issues, mental health, or even dexterity or mobility-based issues, contributing towards, to some extent or greater extent in various geographies, medication non-adherence. What is your take on that?
I don't agree.
Yeah. All right.
I,
Okay. That's good.
I
Yeah.
think,
Okay.
I think, I think
Yeah.
meds adherence actually,
Yeah.
you've got young people who might be on an epilepsy drug,
Right. Okay.
and
Yeah. Yeah.
and they've not got any, they just need support, reminded to when to take their medication, and
Mm-hmm.
then they might then say, well, actually, it makes me feel bad, right?
Right.
So that's why I don't take it. But by
Mm-hmm.
understanding why, that what
Mm-hmm.
understanding firstly,
Yeah.
are they taking it? And
Mm-hmm.
having the data to see that actually you only take it maybe 2 out of 7 days.
Yeah.
And then if the clinician knows that information, they can then have an informed decision with that patient to say, right, what is it? Why are you not taking your medication? Because this can really help manage your epilepsy, and you'll have less fits.
Mm-hmm.
And then they can say, oh, well, the side effects make me feel rubbish. So then you can have a different,
Mm-hmm.
you can talk about the treatment that patient's on. And I think
Mm-hmm.
that's where the issue lies, is that
Mm-hmm.
medication adherence, the data just doesn't exist. We
Yeah.
rely on the patients to tell us that they're
Yeah.
doing that. And
Mm-hmm.
I've met some like ADHD users who say that they have to take their meds in the morning, but they're so like drowsy and like not awake. They'll
Mm-hmm.
often take their medication. They
Mm-hmm.
wake up an hour later and go, oh, I'm not taking my meds. Take it again. So then they've
Okay.
double dosed by mistake,
Wow. Okay. Yeah.
right? But if
Yeah.
it was in a smart box, they would be
Yeah.
able to look at their phone and go, no, I already took it.
Yes.
I
Yes.
took it at 8 o'clock. I opened that at 8 and then went back to sleep.
Yeah.
And so you're at less risk at double dosing with your
Mm-hmm.
medication. So it's right across, it's not just the elderly population. And that's why the toolkit exists. It's right along that care pathway. It's
Mm-hmm.
the minute someone is on some sort of medication, like
Mm-hmm.
take statins, for instance.
Yeah.
We know that people who have had an acute sort of cardiovascular episode,
Mm-hmm.
they're prescribed a statin.
Mm-hmm.
60% of people stop taking a statin after 2 years
Really? Oh, that is shocking. That is shocking.
because
Yeah.
they can't see their heart deteriorating.
Yeah.
And you take
Really.
statins at night,
Yeah.
so you often forget to take it. But if you've got a box that's beeping
Mm-hmm.
by your bedside, and then we'll send you a text message to say it's time for you to take your statin, you're more
Mm-hmm.
likely to do that. And then it will tell your loved ones that they've just missed their meds. So then
Right.
you get an additional prompt,
Yeah.
right?
Mm-hmm.
Um, like within sort of mental health,
Mm.
there was a recent sort of study that showed people with bipolar only take their meds 44% of the time.
Oh, even lower than
And
the average. Yeah. Okay. Yeah.
it's, it's really imperative that you take your medication to support your
Mm-hmm.
bipolar condition,
Mm-hmm.
to stop sort of
Yeah.
incidences happening. And
Mm-hmm.
so it's about having, you don't need to think that, oh, it's just elderly people who've
Mm-hmm.
got cognitive decline. Yes, they are a portion of the issues and the problems, and that's
Mm-hmm.
why the toolkit exists, because they would be given a system like the Avondos. If you've got
Mm-hmm.
cognitive decline and dementia, you
Mm-hmm.
need a more sophisticated technology. But
Mm-hmm.
for something like bipolar, where you might be young, independent, living your life,
Mm-hmm.
you just need a simple prompt. And there are apps out there. I'm not saying, a lot of people manage really successfully with the apps, and that's great. You know
Mm-hmm.
what? Go for it. And I
Yeah.
haven't put apps into the toolkit because there are some amazing apps out there that
Mm-hmm.
do and work for people. And you can set reminders on your Apple Watch, and you can set
Mm-hmm.
reminders. Some people, will often take their meds the same
Mm-hmm.
time they brush their teeth, right? So it's
Mm-hmm.
linked into a daily behavior. And
Mm-hmm.
again, that's a great technique and a tool for you to
Mm-hmm.
remember when to take your medication. But
Yeah.
there is a certain cohort of the population who consistently forget,
Mm-hmm.
or forget intermittently, like
Right. Yeah.
60% of the time.
Mm-hmm.
But it just means that their vital
Yeah.
treatment isn't working because they're not taking it to the 80% that they should be taking.
Yeah. Yeah. So what is the so with your meds on time, um, bundle, what is the impact you're seeing observationally, or is there any further studies going on in terms of improvement in medication adherence so far in the areas where you launched it?
Yeah, so we've got some clinical data around the
Mhm.
MedPA that was done in India.
Okay, yeah,
And what it shows is that actually, if you put the box on its own,
yeah.
you can get adherence of, I think it was 72%. But
Oh,
if you
okay.
put the box with the healthcare practitioner
Mm-hmm.
also involved
Mm-hmm.
and explaining about their condition
Mm-hmm.
and educating the patient, and actually for them to see the data around the
Mm-hmm.
medication, it goes up
Mm-hmm.
to 81%.
Oh,
So
that's very good.
it so it's about linking in the technology into the support network, and that's what
Mm-hmm.
I'm trying to push
Mm-hmm.
for all the time. It's like you can't just put the tech in on its own. You have to have
Mm-hmm.
the support network around that person
Yeah.
also prompting and pushing and
Mm-hmm.
explaining. And it's not just the loved ones as well, it's also the healthcare
Yeah. Yeah.
practitioners, it's adult social care,
Mm-hmm.
it's anyone who's touching that individual basically needs to be talking to them, saying,
Mm-hmm.
let's have a look at your medication adherence.
Yeah.
That should be part of that conversation. Can you imagine if you go to your GP and
Yeah.
in the GP record, they've
Mm-hmm.
got the data of when you last took your statin in the last 4 weeks, of
Mm-hmm.
how many times you opened up and took your statin, or even just accessed your medication at the right time. You have to
Mm-hmm.
be pretty determined to beat that system, I think,
Mm-hmm. Yeah.
to
Yeah.
like keep opening up every night and not take it. I mean, there
Mm-hmm.
are people that will do that.
Yeah.
But they're intentionally non-adherent, and there's
Mm-hmm.
not a lot you can do for those people other than educate. And
Mm-hmm.
I'm not saying these technologies can help everybody. They're
Yeah.
not. They're not meant to go to 100% of the people, but there
Mm-hmm.
is a fraction that would
Yeah.
benefit massively from having
Mm-hmm.
one of the simple tools in the toolkit.
Mm-hmm.
And
The other
it's
thing we
about
talked
just,
about, sorry, yeah, go on.
no, it's all right, go on. No, it's fine.
The one other thing we notice in general is so nowadays you have too much of the gadgets, or we live in the digital world, and there are constant notifications and beeps and whatnot. So have you noticed any of those causes influencing the outcome of your products at the moment?
Um, if anything, I'd say
Yeah.
that the fact that technology is around everyone now
Yeah.
means that there's a wider acceptance,
Mm-hmm.
especially from elderly people,
Mm-hmm.
around the tools.
Mm-hmm.
So, and something like the Avondos, which is so simple to use, and when you present it to maybe someone who's an elderly person who's never had any tech in their house other than the TV,
Mm-hmm.
right? They might have a phone,
Yeah.
but then suddenly they can talk to their sister from
Yeah.
across the world through the
Mm,
machine and have a chat with them on a daily basis. It's
yeah.
incredible. It means that they're like, oh, I didn't think I'd like technology, but this has opened up my world.
Mm,
And
mm,
and again, I was reading yesterday about how the key to happiness
mm,
is the levels of your friendships and your connections,
mm,
so
mm,
with your family and your friends, and
mm,
and that's higher than your
mm.
health and your lifestyle,
Yeah.
right?
Yeah.
It's how deeply you're connected with your family and your friends and your network and your social network.
Yeah.
That's what gives you longevity of life.
Mm,
So the more we can do that and connect people and use technology to connect people, I
mm.
think it's got to be a good thing.
Yeah, absolutely. Yeah. So we have a nice social group, and so we play tennis together. I have a lot of people who work at a leadership level in the mental health organizations and clinical medical directors. So one of the reasons they say to their wives is playing tennis actually improves anywhere between 8 to 10 years of lifespan.
Definitely,
So let us
definitely.
go and play. So yeah.
Yeah, no, definitely. And um, sort of doing anything around play, I think
Yeah,
is
yeah,
a great thing. Like
mm,
taking yourself out of
yeah,
um into a more playful or a sort of creative setting is
mhm,
also, it's massive. It's,
mm,
and having those connections and the regular sort of talking and just interactions with your friends and your loved ones, it's just a win. It's not just all about taking your medication on time. It's
Yeah.
about sort of being
Yeah.
able to taking your meds on time actually then allows you to increase your levels of self-care. And we've seen that. We've got data that shows that when
Yeah.
people do take their medication correctly, they suddenly start to feel better. So then they start to look after themselves, and then they start to go out, and then they start to meet their friends again. So it all sort of builds really that small steps. It's those small micro steps then suddenly lead to much bigger impact around an individual.
Yeah.
So I always think that that's probably the most interesting statistic, is that, and especially people with sort of mental health conditions, get them to take their medication correctly, and they will improve their levels of self-care. It's been shown that that's what happens.
So I noticed that you're doing, in addition to all these things, you're involved actively in charity work also. I noticed that one of the things you do is helping elderly, so people with who are living on their own and so on. So tell me a little bit more about what's your experience and in that space.
So so I've always done charity work, and I was doing that when I lived in my other house. So we used to do, it's a national charity actually. They used to be called Contact the Elderly, but they're not called that anymore. I think they're some Re-engage or something like that. I can't remember what they changed their name to.
Okay.
And it was about taking elderly people out once a month on a Sunday, and you would have host volunteers who would make an afternoon tea. And we would go to their house, and I'd have host drivers who would pick up the elderly people. So we'd pick up 8 to 10 random elderly people and take them to the afternoon tea. We'd then go and eat sandwiches and eat cake and have tea and drink and like have a social environment. And then we would drive them all back home. And there were 8 sort of 10 people. I had about 12 sort of elderly people that we would pick up on a sort of regular basis. And it was really interesting because before they arrived to their first afternoon tea, I'd have to go around and explain the concept to them. And they would go, well, how much is this going to cost me? And I'm like, no, it's free. It's free. We're just going to come and do this. And they'd be like, well, why? Why are you doing that? And we're like, well, because we want to. And they couldn't understand why we were going to do this for free. I'm like, people just want to like hang out with you. Can you just come and, share your stories? And the people that, like the elderly people that we would take to these afternoon teas, they had such incredible stories. And I think volunteering is one of those things that if you're ever stuck in a rut, go and find your local charity shop and go and volunteer in there for 4 hours, because it's so good for your soul. It really is. It's that selfless kind of activity that you've done. You've got nothing out of it. You think you've got nothing out of it, but actually it replenishes everything. It makes you feel really good. You've done something worthwhile. You become part of a community. So I've got friends. I've volunteered at Oxfam. I've only just recently stopped volunteering at Oxfam, and I've made friends from Oxfam, and and they will be lifelong friends. It's just such a lovely thing to do. So yeah, and what I'm doing now is I'm working with a charity called I think it's I think it's like a soup kitchen, but it's not. What's it called? I'll have to think of what it's called.
Okay.
So it's you have to take all this down. So they basically take food, surplus food, and they feed people in a community centre once a week. So we turn up, and it's a bit like Ready Steady Cook. So you've got a whole load of ingredients. You never know what you're going to turn up to. There's like hosts, like cooks, who will turn up and then make a 3-course meal, and it's all vegetarian because they'll only get leftover vegetables from like Tesco's and Morrison's, and we've got people who pick up their produce, and then they make the most creative meals. So we did an egg mayonnaise salad the other day, and then there was a bolognese that we did, and also then an apple crumble. And it's incredible what it's standing in a kitchen and cooking with, again, people you don't know, But you pull together this 3-course meal out of food that was going to end up in the bin, and then you feed 40 people in a community hall somewhere. It's just such good fun, and it absolutely love it.
Excellent,
So,
excellent. So
yeah.
that kind of So, and coming back to a little bit on the mental health again. So, so do you work with any specific local councils or mental health organizations to promote your services?
So I'm slowly doing that with certain sort of councils. We've got the technologies are currently being tested within Wigan Council and Stoke-on-Trent and St Helens. We are working with, so Evondas is being used within Kent with a company called Kindy, and they support hospital discharge. So they are using the Kindy machine with a wide variety of patient cohort. From people with sort of Alzheimer's, dementia, Parkinson's to so, but specifically within mental health, it's kind of you've got councils who are looking to use the technology, but the problem with medication adherence is that it's seen as a health benefit. So when you improve medication adherence, health benefits massively, from a reduction in GP appointments, reduction in hospital admissions, also the length of stay, just reduction in ambulance call out, right? So all the benefits, it feels like a health felt within health. But so therefore councils will often go, well, we've got limited budgets, so why are we paying for the medication non-adherence support? And that's been the wrangle. That's been the wrangle, and it has been the wrangle from day one, because even pharmacists, when they provide those multi-dose systems, the trays, the dosset boxes where they fill those up, pharmacists don't get paid to provide that service.
Right.
These pharmacists do that out of the goodness of their heart.
Right.
And it's only recently that they've started to charge for maybe a dosset box. So medication, on the actual adherence piece around medication, there's lots of care pathways. Like you've got the new medicine service that was launched, and you've got ICSs thinking about polypharmacy and setting up ways to reduce the amount of polypharmacy. But we still don't know when people take their medication and whether they're taking them correctly.
I think that is the
and
sorry, go on. Yeah.
And I think with the NHS, the new 10-year plan, pushing it into community, for the first time, actually, I noticed on the NICE's new strategies where they're going to look at technologies within certain pathways. They've actually put medication in people's homes. And that's the first time I've seen that come out of anything that's so specific. So I'm very optimistic about the fact that we might finally overcome this wrangle between health and social care, and we can all get on the same page and say, actually, supporting medication adherence is it should be a national priority. So if you take Finland and the Nordics and Scandinavian countries there, the municipalities will pay for technologies to go into people's homes, because they recognize that system-wide, get medication adherence right, you get the benefits system-wide. It's such a proactive, preventative piece.
I think. Sorry, go on. Yeah.
No, that's fine.
This is a kind of one of the key issues here, isn't it? So sometimes you have at the system top level, this is what outcome you want to achieve. Then you have various layers of devolution in terms of policy and setting priorities, and also funding arrangements. So sometimes when the issue like this is going to have cross-cutting benefits across various of these units of the government. So how to get them all aligned and think together and then create something that would. So I think we. Do you think that we are reaching anywhere closer to that kind of working, kind of end-to-end, looking at a holistic in a comprehensive way, one citizen or one person? We need to make a decision that's going to add greater benefit so across. What are your thoughts, or at least?
Yeah, no, I'm optimistic about the 10-year plan, to be honest,
Yeah.
um, because it's pushing it back into the community, and
Mm.
I think that's where it needs to sit. It really
Yeah.
does.
Yeah.
And also the strategy at the so previously it's always been you've got to find the in-year cash savings, right?
Mm-hmm.
Within a
Mm-hmm.
year, or
Yeah.
within the day one, we want you to find
Mm-hmm.
those cash savings. Whereas
Mm-hmm.
the thinking now and the future plans that are coming through are saying, it's over 3 years, it's over a period of time. But actually, the daft thing about adherence and the technologies in the toolkit is that
Yeah.
I can actually give you a cash saving within 4 weeks,
Mm-hmm.
because you'll get those people to start taking their meds correctly,
Yeah.
and you'll start seeing those benefits. And
Yeah.
take the Avondas, for instance, you
Yeah.
can
Mm-hmm.
reduce carers going in. So currently you've got
Mm-hmm.
the NHS pays for like 15 minutes or 30-minute med calls. So they send out district nurses to do these med calls. And yes,
Mm-hmm.
I'm not saying that everybody can benefit from just having the Avondas in place, but because you might
Yeah.
need to put in do injections or creams or something else like that. But you can
Mm-hmm.
support quite a lot of that through the video functionality. And if you
Mm-hmm.
can release capacity and you can say to those district nurses, well, you might now only need to go in once a day, and the
Mm-hmm.
other 3 times it's basically tablets and creams that we can support from through the camera,
Mm-hmm.
then you could have someone sat in a central location
Yeah.
dialing in through the machine to all of
Mm-hmm.
these machines, robots right across their locality, and it
Mm-hmm.
frees up all this capacity.
Yeah.
And so I can prove the cost savings on these machines pretty much
Mm-hmm.
within 4 weeks. But because
Yeah.
there's never been a NHS kind of focused around this, it's
Mm-hmm.
been really hard to get projects to scale. I've got more pilots than Jet 2,
Yeah.
right?
Yeah.
That's what we
Mm-hmm.
always say. It's like I've been
Yeah.
involved, but it's like, but until we have the system wants to
Mm-hmm.
improve this, and
Mm-hmm.
it does need to be a joined up health and social care approach. It can't just be social care. And when I was talking about where this technology is being supported, it is within adult social care, because they will pay, because
Yeah.
they recognise that actually they can stop carers going around, because we don't
Mm-hmm.
need to send carers around 4 times a day. We could just
Mm-hmm.
send them maybe in the morning and the evening to do some personal care. And the two middle calls can be done. They can do their meds by themselves, and they don't need to go in to
Yeah.
support around that medication.
Mm-hmm. So, how does your services um, costing wise it work for the patients? Is it they have to pay the kind of capital in terms of buying the equipment, or is it only subscription only, and then equipment is supplied
Um,
free?
so the med per unit, the smart
Yeah.
pill box, is a one-off cost of £99.
Right. Okay. Okay. Yeah.
Ivondos
Yeah.
is usually commissioned through, say, a care provider or an ICS
Mm-hmm.
or a council,
Mm-hmm.
and it's £185 a
Mm-hmm.
month.
Mm-hmm.
And with the camera, it's £220 a month. So
Right.
we've
Okay.
got a care provider using the Ivondos system,
Yeah. Mm-hmm.
and as for their private clients.
Mm-hmm.
So they're finding people whose loved ones are like, I'm not sure mum's taking her meds correctly. I
Mm-hmm.
think we should send a carer around to help her with her meds. So
Yeah.
rather than do that,
Yeah.
Guardian Angels in Surrey have actually
Yeah.
said, well, we've got this amazing technology that we could put into this person's home,
Mm-hmm.
and then it will dispense the meds at the right time. And we can do a video call as well when it's time for
Mm-hmm.
them to take their meds, and
Mm-hmm.
sort of have a chat with them, watch them do it, and then we can call them again later on in the day. So they've
Okay.
actually worked out a service. So they
Mm-hmm.
buy the machines, or they rent the machines from
Mm-hmm.
Ivondos, and then they build that service package around for that
Mm-hmm.
individual. So I think they charge £10 for every virtual call they do to the
Right.
individual, and they charge a fee to go around and fill the medication up every month.
Right.
But it's meant that they've been able to bring people into their service who
Mm-hmm.
don't need care yet. So it's
Yeah.
pre-care.
Yeah. Yeah.
And one of the individuals, he'd had a stroke, and their family was saying, oh, we're really worried about him taking his medication. So they put the Avondas machine in. He
Mm-hmm.
started taking his meds properly. He's realized he feels better because he's taking his meds correctly. They think
Mm-hmm.
he's on track now, so then they've pulled the machine back out again.
Right,
And
right.
if he starts to struggle again, they can put it back in again.
Mm,
And ideally he'd have gone onto the Medper box, so you'd have put these meds in the Medper box, and
mm,
he would have just transitioned back down to another piece of technology. But
mm,
it's all about sort of using the technology really to support people at the right time.
mm-hmm. Okay, yeah.
So
Hmm.
yeah,
So now, what's next for Meds on Time?
global domination.
Right. Okay. Yes. Okay.
um,
Yeah.
I think it's such a hot topic. It always has been. And
Mm,
there's some great people working within the space.
mm,
So it's connecting up all those people. I think
mm,
try and get the little
yeah.
med per box out to as many people as possible and improve
Mm,
medication adherence.
yeah.
It's very simple to use, and that at the low cost of like £99, it's almost like
Yeah.
here's a present because I love you, right? It's like I want you to take your meds on time, and I want the peace of mind to know
Mm,
that you've
yeah.
taken your medication correctly, so I can stop hassling you and saying,
Mm,
"Mom, have you taken your meds today?" And you don't need to have that conversation. You can
yeah.
open up the floor to a better conversation, like, "Have
Mm-hmm.
you gone to see your friend, or are you making any plans to go, or should I take you
Mm,
to the M&S for a coffee?" Although
mm.
they think they're shutting all their cafes now, aren't they? So you can't go there anymore. Uh,
Excellent, excellent. So there you go. So you started. I told you that you are an economist, and you not only economist, you are a behavioral economist and then health economist as well. Now so you just covered the entire spectrum of that now.
Yeah,
Right.
maybe.
Excellent. So great. So listening to how kind of you're making big changes and creating that social impact through your important service. We wish you all the best, and maybe we can reconnect again for a panel discussion or something sometimes when I'm trying to connect a few
Yeah,
more people
no,
in that space. Yeah.
that would be amazing. Yeah, no, it's great. And it's so incredible that we met on that NIHR
Yeah.
course, really. And
Yeah.
again, it's, that opportunity. It's like, well, shall I go? I'm going to take out like 5 days of my life to go to
Yeah.
this thing. But
Yeah.
you never know who you're going to meet. So,
Yeah. Yeah.
yeah,
Great.
brilliant. Thank you, Vasco. It's been
Thanks, Betty.
incredible.
All the best, and
All
we'll
right.
keep in touch. Yeah. Thank you.
All right. Thank you. Bye.